My name is Alan Roberts. I hope everybody's doing fabulous today. I've got many videos today. We'll be talking, by the way, at 1 p.m. Eastern time. Hang on. I'm not sure. I got to check real quick. So at noon Eastern tomorrow, myself and Andrew Meyer for Jewcast will be talking to Will Chamberlain. So it should be an amazing conversation. I'll have the link up for you before too long. But today we are here to discuss RFK was at a hearing and unveiled one of his plans for Make America Healthy Again agenda. And I'm just going to say this, and I truly mean this. Like, I think it's safe to say that more than just about anybody else, I have been talking about getting people healthy, getting the country healthy, how this is an actual problem. You can find videos of me 3 years ago talking about making America healthy again before he ever even uttered those words. You can find videos of me talking about how the healthcare system is actually a sick care system from 7 years ago. You can find videos of me discussing how ultra-processed foods are bad for you. You can find videos of me discussing how it is a national security and national emergency to have as many obese people and people with chronic illness as we have. I have talked about this ad nauseum for years now, for about 6 or 7 years. Almost to like a completeness of, I started this doing comedy, and now it's not comedy anymore, although I try to add comedy and get people to laugh. And for those of you that don't think I'm funny, you're just fucking pussies. It's funny, it just hurts your feelings at the same time, frankly. So, and if you don't think I'm funny, it's your opinion. I don't give a fuck. But I have been talking about making America healthy again in one way or another for a long time, well over half a decade. And I just keep seeing it get worse and worse and worse. And a future book of mine that's coming out is Fat, Sick, Weak, and Dependent, the Engineered Epidemic. That book is being written right now, going over the history of our healthcare system from the early 1900s through now, where it's very clear to me, and I'll present evidence in the book, that they want you fat, sick, weak, and dependent upon them. And by they, I mean the government, big food, and big pharma working in conjunction together. The federal government has facilitated the chronic illness epidemic without any real, like, there's not even really a possible way to debate it, as they're the ones that decide what drugs get approved, what foods get approved, those sorts of things. It's not really an argument to say that they weren't facilitating the chronic illness epidemic. We can argue whether they intended upon it, or we can argue whether they knew that they were doing it. But that discussion is either they're incompetent and shouldn't be telling us what to eat, do, stay fit at all anyway, nor should they be in charge of our health care, or two, they know it and just didn't want to do it, which means they're facilitating it. So I get that people don't want to, like, they don't want to admit to themselves the truth that I say about this, but the government wants you fat, sick, weak, and dependent upon them, irregardless. And I'm talking right now still, okay? And I am a big fan of RFK. I hope he's able to accomplish a lot of shit, but he is not going to be able to accomplish making America healthy. Like, he wants to make America healthy again in 4 years. I'm sorry, sir, but it sounds to me like you might be back on the fucking drugs, because to think that we're going to go from over 50% visceral obesity in America, because as of 2018, on an average, the average American was viscerally, morbidly obese. By viscerally, I mean their waist to height ratio put them in a morbidly obese category, and that's information you can find on the CDC website. It's just not spoken about because while they released the data, they didn't want to inform people how fucked up it is. So I'm very happy that RFK, and very frankly, RFK was solidified my vote for Trump, even though I was never going to vote for somebody that was campaigning on taking my fucking rights away. You've got to be a fucking moron to do so. But I'm a big fan of his. Like, I really am. I hope to meet him someday. I'd love to have a discussion. But his way, like what they're doing right now, him and Callie Means and Casey Means and all these people, you're not going to get America healthy again until you address our actual fucking culture, right? Like, you can add all sorts of things to it and take away all sorts of things. Like, you can take away the dyes from food as long as there's still ultra-processed calories being eaten at high degrees. If we're still getting 60% of our food from ultra-processed food, we're not going to be healthy. And that shit's not going to change unless you outlaw ultra-processed foods, which is against freedom, and I'm not for anyway. We need to impress upon people that they need to take care of themselves, that it is their responsibility, that it is not the government's responsibility. And I'm just going to go to this video that he has, because I think it's important. One more time, everybody, I am not, and I mean, I am not against this motherfucker, right? I'm not. I'm not against him. I'm not. This is not what I want anybody to think that I am, okay? What I can clearly tell you, though, is that I don't think that the Make America Healthy Again movement is actually being effectual in making America healthy again. I just absolutely don't. Let's play this video by him. And again, big fan of RFK. Hope to meet him someday. I would love for you to reach out to me or answer the message I sent you. That way you can understand what the person who originated the phrase "Make America Healthy Again," because I believe I said it before anybody else years ago. One more time, I got this shirt that I have it printed on from 3 years ago right here. But I would love to talk to this man to make him understand where it's coming from, because I don't believe he's had problems with weight. I don't believe most of the people that are talking about this shit have had problems with weight. But I can tell you right now, fitness trackers trying to get a fitness tracker on every single human fucking being's arm in America within the next 4 years, that sounds like a money grab to me. And I'm very disappointed that I have to say that, but it certainly does. If RFK or anybody in his circle owns any stock in wearable devices, very frankly, it's kind of damning to his credibility, if you ask me, because he is now stating that everybody should wear them. We're going to listen to this real quick.
We're about to launch one of the biggest advertising campaigns in HHS history.
Taxpayer funded, by the way.
To encourage Americans to use wearables. It's
ridiculous. You've never helped anybody get really healthy if you suggest a wearable. I'm just saying.
Way of people can take control over their own health. They can take responsibility. They can see, as you know, what food is doing to their glucose levels, their heart rates, and a number of other metrics as they eat it. And they can begin to make good judgments about their diet, about their physical activity.
And this is a serious question to RFK and anybody in his circle. Do you think these people don't realize that how they eat is unhealthy for them? Like, do you actually think that, it's just a decision-making tree, right? Like, they don't know enough about food. Like, these are people that have eaten in a way that has fattened their body up to the point where they can barely move to a certain degree. I mean, because I can tell you this right now, people like me are not going to be wearing a wearable just because RFK suggested it. Like, I don't track anything like that at all. I built a healthy, sustainable lifestyle for myself. And I follow the daily steps I need to maintain that healthy lifestyle. I've lost 100 plus pounds and kept it off for 4 years. I haven't binged in 4 years, 5 months, and 9 days. Thanks to the methods we've done and the supplements we use. Wearables confuse people, and we're going to get to that in just a second.
About the way that they live their lives. We think that wearables are a key to the MAHA agenda, making America healthy again. And
I would love to understand. I would love to know why you think that a wearable is a key. Like more layers of shit is somehow the key, instead of just going to the very basics of sleep, hydration, stress relief, and avoiding ultra-processed foods, getting activity a day. I'm sorry. That does not sound like it will work to me. And by the way, I am a weight loss expert. So, I mean, like that doesn't sound good to me, dude. Like you need to, like, somebody, like, everybody tag RFK and have him reach out to me, because this is missing the mark to a tremendous degree.
We are going to, my vision is that every American is wearing a wearable within 4 years.
Every American is wearing a wearable within 4 years. That's sounding awfully deep statey to me. Just going to point that sounds awfully like, hey, we want you to wear this thing that also has GPS in it that tracks your fucking biometrics, it oftentimes is connected to a food tracker, so you are going to track what you are eating too. I'm thinking no, but I'm thinking no. That's not a thing for me, you know. And just so everybody knows, that was during the House Energy and Commerce Health Subcommittee meeting on the 24th, so 2 days ago. His rationale is clear. Wearables could serve as an early warning system for health conditions. We're like so far over the rainbow tipping point of that shit at this point. It's this is very much like, you know, trying to close the horse gate, the horse pen door after the horse is running in the field. That's very backwards thinking. I'm honestly surprised, but again, to RFK and anybody in the Maha movement, I've been big supporters of yours and still am big supporters, but you're missing here. Like this is a very serious flounder that is going to lose a lot of people's respect and a lot of people's trust. Now I'm looking at you like, I think you might have some ulterior motives besides making America healthy again, right? It's kind of crazy that I have to think that about this man, because I really do like him. I really, really, really do. It's just not a good look, especially when you consider that they want to use this as an early warning system for health conditions, particularly benefiting for those that have chronic conditions like diabetes. As a fucking newsflash, it's very easy. It's very, very, very easy to deal with diabetes. It's super fucking easy. Don't eat carbohydrates. Like, if you do eat carbohydrates, they should be in like form of like lettuce and berries and like high fiber vegetables. You should not, if you have type 2 diabetes, just eliminate ultra processed foods and processed sugar, and that will help a tremendous amount of that. Type 2 diabetes is 95% manageable, reversible, or avoidable by lifestyle. So type 2 diabetes is a self-inflicted condition in about 95% of the time. And we shouldn't even be like, very realistically, one, doctors are not qualified to treat diabetes because they do not understand how a person gets diabetic because they know nothing about nutrition. Literally, they are not qualified to treat type 2 diabetes. I will make that argument. I would absolutely love to have that debate live with a doctor, because you guys are not taught shit about nutrition in medical school. Most medical schools, 80% of all medical schools, which, by the way, Rockefeller is the reason why this is, but 80% of all medical schools have no nutritional requirements. Had no nutritional requirements at all. So how are you going to treat a nutrition-born chronic illness, which most of them are? Most chronic illnesses are lifestyle related, and we teach doctors nothing about lifestyle. We teach them how to pharmaceutically or surgically maintain or manage a person's chronic illness. We do not teach anything about prevention. We do not teach anything about reversal. We do not teach anything about nutritional management for them at all. In most colleges, I have very likely reversed many more cases of type 2 diabetes than the average general practitioner. And I'm putting that out there because I have cured, my wife and I have reversed many cases of type 2 diabetes, hundreds of cases of prediabetes, like hundreds, probably close to 1,000 cases of prediabetes. Like, we have done that. We have very likely saved more lives from diabetes than the healthcare industry, like, as an average person too. Like, if you take what we've done as two people and average it out for the two of us, and then look at the average doctor, we're both crushing them because they don't try to cure you. And that's another one, you know? So the rationale is fucked up. I'm just saying it. They want a continuous glucose monitor in these things. Is one of the things he's talking about. He wants it to be a continuous glucose monitor, and it's just wild to me. Okay, like let's go to this. Okay. One of the most pressing concerns for the potential is information overload. I'm going to be very honest. Most people know that it's the food that is fucking them up. Most people know that it is their caloric intake. Like deep down, if you hooked every fat person up to a lie detector test, to a polygraph test, they would not pass it if you ask them. Like they would not be able to pass it by saying, no, I don't think my lifestyle has anything to do with this. Like they all know. Like you know that you overeat. Like it's I know we have a bunch of societal, like population level societal lies going on, but fat people know that they did it to themselves. They just don't want to admit it. And we have a culture right now in society that allows people to completely absolve themselves of any personal responsibility when it comes to their personal health. And that's where we're at. That is what we need to change. We need to make it so citizens have to participate in their own health care. And the easiest ways to do that, by the way, are to stop shared healthcare burden. Like, I'm not saying people shouldn't get treatment. I'm not saying people shouldn't be able to access healthcare. But if you are eating in a way, drinking in a way, smoking in a way, living in a way that is going to cause you to need more healthcare than what you would have if you would have taken care of yourself, we should not be paying for that. It should not be a burden upon all people. It should be a burden upon you because you're the one that's making the decision not to do so. So I'm not saying you shouldn't get healthcare. I am saying that chronic illnesses that are derived from lifestyle-driven factors should not be covered by insurance. They should be 100% out of your own pocket. And that would convince people. I know people don't like the idea, but tough love actually fucking works. And if you can't afford to eat food because of your medicine, you're going to lose weight and likely get better anyway. And it's just logic. Like it cannot fucking be explained any other way, right? So wearing wearables generate a constant stream of data, steps, calorie burned, heart rate, variability, sleep stages, more, even blood glucose levels when they're hooked up to a continuous monitor, which can overwhelm users, particularly those already health conscious. Like if you are trying to lose weight already, like, and I've seen this dozens and dozens and dozens of times. If you are already trying to lose weight, like you're fat and you've decided I need to lose weight, the basics are where you should start, not the I need all the information type shit, right? Like you clearly make poor choices on a consistent basis that negatively affect your health and that will put you in a very serious negative health status. But we're trying to better that when you're trying to lose weight. You're trying to build healthier habits. This will not build healthier habits because it makes it so things are not habitual. If you're constantly reacting to a steady stream flow of information, it makes it so you can't focus on the basic things. If you are unwell or it looks like you are going to end up being unwell due to your lifestyle, how you eat, how you drink, how you smoke, how you sleep, how you hydrate, all those things. If you live an unhealthy lifestyle, wouldn't it make more sense to change your lifestyle instead of gathering all the information? Like this perpetuates the stupidity of America too, because it kind of pretends like people don't know what's good and what's bad for them. And don't get me wrong, I do blame that to a certain degree on the FDA, the CDC, the NIH, the USDA, especially. The USDA has done more to confuse people, and the USDA should absolutely be absolved as a government agency because it has facilitated millions of deaths, trillions of dollars in expenditure, because it literally pushed the food pyramid. And everybody, if you don't realize the food pyramid's bullshit, you're too stupid to talk to me. Like, if you think that 11 servings of grains to be suggested to the average American was anything more than a gift to the ultra-processed food industry, you're too stupid to understand me. You're just too dumb. So you should read my book when it comes out, Fat, Sick, Weak, and Dependent, The Engineered Epidemic. So 2023 longitudinal randomized controlled trial, which is something that RFK says he really is big on, published in the Journal of Medical Internet Research, examined the effects of wearables fitness trackers on effect, behavior, and health. The study found that participants receiving 40% deflated step counts feedback compared to accurate counts perceived their activity as more inadequate, leading to unhealthier diets, increased high-fat food intake, decreased produce intake, more frequent negative acts, reduced mental health and self-esteem, and increased physiological stresses, higher resting heart rate and blood pressure. This suggests that inaccurate or overwhelming data can trigger stress responses, potentially exacerbating health issues rather than improving them, which would also exacerbate eating because you would be very, very hungry. For an already obese-prone society, where many struggle with weight management and self-esteem, constant reminders of perceived inadequacies could lead to a disordered eating and overexercising, particularly amongst vulnerable populations. So if you also then undereat and overexercise, that is a temporary diet that will not last, and you will eventually go back to your old binge eating behaviors, your old behaviors, right? Accuracy and reliability concerns for them are also a problem, because another critical issue is that the accuracy of these devices is very much in question. While they provide convenient data, their reliability varies, potentially misleading users. A 2018 European study published in PLOS One found that Fitbit Charge 2 trackers had an average heart rate 6 beats per minute slower than an EKG, with overestimates up to 16.8 beats per minute, and underestimations of up to 28.5 beats per minute. So basically, when you think you're getting your resting heart rate from a wearable, you're not getting your resting heart rate from a wearable. You're just not getting it, because it can be wrong by up to 50 beats per minute as a ratio, right? Like, they're not very good. Don't get me wrong. I'm not trying to knock wearables. If you like it, great, but they're not good health tools. That's for fucking sure. I mean, and I would argue my professional reputation on it, because I don't use them for my clients. When my clients use them, I'll collect the data, but it's something we should get you off of before you're done. Like, if you have lost 100 pounds and you are now stuck calculating everything you eat, stuck measuring every gram of food you eat, stuck figuring out how much water you're drinking, all these things should be habitual, right? How you eat should be habitual. It should be focused around your hydration and whole foods, with having ultra processed foods being a very small minority of what you take in, if at all. There's no reason to eat ultra processed food at all. They should be viewed as eaten for enjoyment or convenience only. And it should be 5 to 10% maximum of your total daily caloric intake. And it shouldn't be more than one serving a day, because every time you eat ultra processed foods, it actually, every time you eat ultra processed foods, it increases your inflammation, especially in your gut microbiome. Your intestines inflame a little bit more. Your stomach inflames a little bit more. It causes systemic inflammation every time you eat it. So once a day is absolutely fucking fine. Or less, but they're not accurate. And for a person that is desperate to lose weight, accuracy is important, right? So inaccurate data can lead users to making misguided health decisions, such as overexercising to compensate for perceived low activity, or ignoring actual health risks due to failed reassurance. For a society already struggling with obesity, such inaccuracies could exacerbate poor health outcomes. There's also this, and this is something that I'm going to go on. First of all, I don't wear a lot of jewelry, period. And I have worn a wearable at one point in time. I wore a wearable years ago when we used to do the Sit Food for Six charity events. Charity events my wife and I used to do. And I wore a wearable for a couple of them. I personally don't like wearing jewelry. Shit, I even got my wedding ring tattooed on me instead of wearing a ring. That way it's permanent, and I just don't like wearing jewelry at all whatsoever. I don't like it on my body. Something about my ADHD and having stuff on it just constantly fiddling with. I don't know. But you're wearing something that is connected to you, right? You are wearing something that is connected to your name. Most of the time, your name, your social security number, everything like that, because you have gotten this through a phone service. So they got all your info, and now they know your blood pressure. Now they know your heart rate. Now they know the food you're eating, because most people track their calories through that. Now they know all of these things. There are very serious privacy and security risks that come with wearing something that has GPS on it all the time, tracks your fucking heart rate, glucose levels, all that shit, that is then, transmitted places. I would just, personally say that that's wildly stupid. Wearables are not suitable for everyone also, particularly those with mental challenges. A 2025 article from UC San Francisco warned that trackers might be harmful to individuals with eating disorders, as constant calorie burning data could lead to obsession. And I completely 100% agree with this, which is another reason why I think that this is way off the goddamn mark. Seth Creasley, PhD, noted if someone is already having a bad day and they look at their fitness tracker and see they only got 1,000 steps, it might send them into a negative spiral. A 2017 study in BMC Public Health found that some users abandon trackers due to discouragement from feedback, particularly those with poor health or chronic conditions. So in other words, it actually produces a negative effect where they just kind of give the fuck up, which is my personal experience with thousands of fucking clients. And let's see here. What else we got? And again, I wonder, for an obesity-prone society where sustainable behavior change is crucial, relying on wearables that give you constant different variables all throughout the course of the fucking day just does not make sense to me, right? Like, we live in a society where, like, if you're morbidly obese, you need to focus on, like, we at our coaching, which, by the way, I'll share the link for our coaching too. We have a few slots available, not a lot. We've got a few. And they are right here. I'll just do all of these. It's good. So 3 month, or 1 month to month, 3 months, 6 months, 1 year, right there. But what we do in our coaching, instead of putting somebody on a wearable, like, they come to you, start off with one thing for them to focus on and master. Hydration. We always start with hydration normally, because hydration is the best bang for your buck, right? Hydration gives you satiety, decreased cortisol levels, improved sleep, those sorts of things, right? We start on that. We make it habitual. We increase their fluid over time. We have them start building the habit of mindfully eating their food. They look at their food first and think about it. That's one of the things we do in our coaching, because that's why they send us pictures, right? The pictures are, one, so Crystal and I can see their portion sizes. But two, it is to get them to stop and think about the food, right? And then we go through the whole process where a lot of people say, well, it's really working because I didn't want to take a picture of this and send it to you, so I didn't eat it. But that's just the concept of borrowed authority, because that means you know it's likely not good for you. You just don't want to show it to me. And once you become your own authority, you're good to go. But that's my take on this. I do got to run because I got another video I want to do here today. And then I will be back live again at 5 p.m. with Dr. Alan Chen for another episode of Evening Rants, where we will discuss some spicy topics. We are going to discuss how the FDA approves drugs with no safety data at all. Hundreds of drugs with no safety data at all. Like, you guys believe it? Trusting the FDA, trusting your doctor. If you still do those things, it's one thing to listen to them and have them try to convince you. But just trusting a doctor, like 371,000 people a year die from medical error. It's more people die on average from medical error than died on average per year from the vid, and everybody changed the fucking world for that shit, but yet we don't. So I hope to talk to all you guys in just about 3 minutes. My name is Alan Roberts. Goddamn.